Looking back in retrospect, I've been a little angry. Not angry at him, and not angry at the person, the whole accident, but the situation. It seemed like I was so angry at the situation, and it consumed me, and it was a tough thing for me to deal with.
I realized years later that I think I was quite cynical. I basically kind of was, as a kid, I was kind of at war with life, and at war with the fates, and at war with God, and at war with any situation with the universe that could have basically taken an innocent, lovely, wonderful person and given her this condition. I didn't understand the justice of it or the logic of it, and the fact that that's the kind of world we lived in made me really angry.
A lot of people who have family members who are dealing with mental health, teenagers especially, do not deal with it in healthy ways. And especially with the students that I work with who have had experience with mental health issues or who have had family members experiencing mental health issues, you start seeing missing class a lot. You start seeing getting into fights at school or outside of school. You start seeing reckless relationships, reckless sexual activity. You start seeing sometimes criminal activity. You start seeing basically anything you can label a kid as a bad kid. You start seeing those behaviors, usually in my experience anyways, with students who are dealing with mental health issues in the home.
For children, in the larger community, if they have a family member with a mental health, the stigma, they're afraid to talk about it in school. They think that other kids would think that they're weird or that they're not normal and not in a normal family. But the fact is 1 in 5 people in our community and all across the world will be impacted by mental health. Therefore, it could be just anyone. And that breaking down a stigma is very important, and we see that with the youth and children. They do not want to talk about it because for youth it's not cool, and the media makes it sound like it's something wrong.
I find that with children, when they don't have accurate knowledge of mental illness, they make up their own conclusions, which are misleading. They can be destructive because they can come up with thoughts that, it's my fault. I'm the reason why my parent is this way or my family member is this way.
We're trying to teach children that they didn't cause this illness, and they can't control this illness, and they can't cure this illness, but they certainly can cope with this illness. So we try to instill a sense of resiliency and hope in children the same way we do with adults, but we just do it a little bit differently in maybe a bit more playful way. And their artwork tells us a whole lot about how they feel, and they've seen a world of hurt, and they don't know how to quite verbalize it. So we see children with a lot of anger, and we see children who are acting out, and we are seeing children at high risk for problems themselves. And they're, immediately they're being diagnosed as ADHD or a problem child or these things, when really they're just confused. They don't understand what's going on. A parent disappears in a hospital for months on a time, and nobody tells them what's really going on, because they assume that they won't understand it. And they bear the burden of the anxiety just like an adult family member would. But they're not validated and they're not recognized that way. And yet they are caregivers.
The first initial session or the first session in the group, they're like, are there other children, that are like me? Have a mother, father, brother, sister, aunt, or uncle that have bipolar, schizophrenia, depression. And once they come into the room, and especially in the groups, and they see other children, and they're like, wow, it's not so uncommon. And they start to build peer support networks, and they start to develop friendships, build upon social skills.
Once someone puts confidence in other people and opens up in that way, and they open up to somebody and the response is positive, things start to turn around for that person. And I've seen it with, you know, a few students I've worked with, that once they start to confide in other people, they realize that, hey, you know, this issue I might be going through or my family member might be going through is one that I can cope with if I have the proper supports. And at the end of the day, I'm still a normal person. There are just difficulties in my life, and everybody has difficulties in their life at some point. And I think it kind of, they get rehumanized, because I think at some point the stigma dehumanizes you. So to put confidence in someone else rehumanizes you. And once you start to care about yourself again, all the, you know, your life kind of starts to fall back into place. You know, the pieces of your life kind of start to come back together.